Welcome back to the NYSORA YouTube channel, where the science meets real-life anesthesiology. Today, we have a really challenging case, one that's becoming increasingly more common. Our patient today is a 65-year-old male with multiple medical problems, including a recent coronary artery stent. Now, he fell off a speed electric bicycle and suffered a shoulder fracture. Let me just pause here for a moment. Why are we regulating the speed on the roads for cars with radar and cameras, but speed bicycles fly past pedestrians at 40 kilometers an hour with no oversight? Honestly, these bikes might be hurting more people than cars in some cities. But anyway, back to the case. So the patient is on Apixaban, last dose taken 2.5 days ago. The surgical team is planning a total shoulder replacement, and here's our clinical dilemma. Can we safely place an interscalene catheter in this patient? This will be our go-to for continuous postoperative analgesia, but is it safe? Let's ask NYSORA's anesthesia assistant, MAIA. Can I place an interscalene catheter in a patient on Apixaban, last dose 2.5 days ago? Now, the case manager in MAIA, NYSORA's anesthesia assistant, now goes to NYSORA's databases and checks out the facts before reaching out to other sources that we specified. So let's see what it says. In a patient on Apixaban who took their last dose 2.5 days ago or 60 hours ago, placing an interscalene catheter should be approached with caution. And review the literature, we do know the recommendations to wait 72 hours after the last Apixaban dose before performing a neuraxial, deep peripheral nerve block, or catheter placement with a larger needle. So technically, we're just approaching the threshold, but we still need platelet function, renal function, and procedural risks factored in. So placing an interscalene catheter at 2.5 days post-Apixaban dose is likely too soon, according to the current guidelines. It is safer to wait until full 72 hours have passed since the last dose, and if analgesia is urgent, consider a single-shot superficial nerve blocks, e.g. single-shot interscalene block with Exparel instead, which has lower bleeding risk. That's a good recommendation, and I think maybe we can go with that. And if the catheter is no go, we can definitely rely on a single-shot interscalene block with Exparel. But I'm going to retype again, just to make sure that we get correct answers here. Is a single-shot interscalene block with Exparel appropriate in patients recently on Apixaban 2.5 days ago, the last dose? MAIA accesses NYSORA's information and the content in the back end and comes up with these recommendations. Interscalene block is generally considered a superficial nerve block, not a deep block, because it targets the brachial plexus root trunks located 1 to 3 centimeters depth from the skin. According to ASRA guidelines, superficial compressible nerve blocks like the interscalene generally carry a lower risk from bleeding and do not require as long as a washout period for direct acting anticoagulants. So for patients on Apixaban, performing an interscalene brachial plexus block with appropriate timing since the last dose, usually about 48 hours, is okay, as long as you use the color Doppler to avoid vessels. So, in summary, the interscalene block is superficial and compressible. This status supports safer performance in patients on Apixaban. Therefore, we can use Exparel here. And that is because single-shot blocks are generally considered to carry a lower risk, bleeding risk, than the catheter techniques. And while caution is still advised, ASRA guidelines considers single-shot blocks intermediate risk, particularly if done using ultrasound guidance. Now, so in summary, an interscalene catheter might be placed if we cross that 72-hour window with normal renal function and no additional bleeding risks. But if that is not the case, a single-shot block with Exparel could provide a safe and effective plan B. And this is exactly where we having a clinical assistant like MAIA make a difference, rapidly summarizing the data and giving us guidelines at our fingertips at the point of care. But what would you do in this situation? So drop your thoughts in the comments below. And if you find this discussion helpful, subscribe to the NYSORA channel, give us a like.